Hello, everyone. Welcome back, and welcome to another couple of weeks where we're going to be shifting gears yet again to be focusing on a new form of therapy that's distinctly different from both person centered and rational emotive behavior therapy. So, Adlerian counseling is going to really shift gears in a big way that's a little different than how we've been thinking about counseling in the previous two therapeutic interventions that we've talked about so far. So, person centered therapy was all about how the counselor creates the type of environment that's going to help a client sort of explore themselves and get to where they need to go. REBT is all about really highlighting and honing in on a rational thinking pattern. So, really trying to bring to the client's attention the way that they're thinking about a situation and how it's either helping or hurting them. Adlerian therapy is coming at counseling from a very different perspective. Mainly, we're going to be focusing in on the past when we're using Adlerian counseling. So, when we think about Adlerian therapy, it's about how do we make that connection between early childhood experiences, what that taught you about the world, and how that's really showing up in how you're operating and in your present day. So that's how Adlerian's going to operate, and really where the focus is for us as therapists. Now, when it comes to Adlerian therapy, it's really important to consider the contributions of these two sort of giants in the therapy world, Sigmund Freud and Alfred Adler. And the reason these two are most of the time connected is because Alfred Adler was a student of Sigmund Freud and was following along with his line of um, how therapy operates and how to interact with clients. So Adler followed Sigmund Freud. He was a student for many, many years, and then eventually broke off and started his own form of counseling because of some significant differences that he had between himself and his teacher Sigmund Freud. So in terms of Freud believed that people are destined to pursue what they want out of life largely because of their ingrained sexual urges and also their inherent aggression that people just have. So Freud really believed that people are born with a sort of drive to move in a certain direction and to follow certain instincts that are just inherent in every single person. So when Freud would work with his patients, he would really be hyper focused on, let me understand what your sexual urges are telling you to do, and I need to figure out what those urges look like from client to client. But Alfred Adler didn't quite believe that. He didn't like the idea that people are born with inherent sort of urges or things that are guiding them, even without any sort of influence from the outside world. And that was one of the big things that he differed with Sigmund Freud. So Adler believed that people are not inherently aggressive or driven to act in a certain way, but through a process of kind of understanding the world from their experiences from a young age, they learn how to act in their environment based on the things that they experience around them. And Alfred Adler really believed that what people want more than anything is just to be successful, however that looks to them. So that was one of the big things that sort of drove a wedge between these two therapists, and why Adlerian therapy is substantially different from Freud's style of therapy. So we are really going to be looking at Adlerian type of counseling and understanding how can we sort of as therapists get a better idea of the early childhood experiences that a person has and how that connects to where they are now. So, one of the best ways to think about how this whole Adlerian counseling process happens is to think about a blueprint. In terms of people are born with sort of a blank canvas, according to Alfred Adler. And throughout all of their experiences, all of the things that they see from their family, from people around them, from their early experiences with school, they start to develop this idea around how the world is supposed to work and how they are supposed to be in the world in order to be successful. But there's not necessarily a right or wrong way to be successful in the world. It's really just what you learned by growing up. So the first 6 to 8 years of a person's life are considered incredibly important for this type of therapy because that's when you really start to put together all the pieces of the puzzle to understand how the world is supposed to work based on what you see around you. So some of the key questions that children start to answer from those early years, and the things they see around them from people and experiences that they have are things like how to be successful as a person. If I want to succeed, what do I need to do? How do I need to think? Where do I need to go? All of those sorts of things start to take form at an early age. How others should treat you takes form, and you get those from experiences by watching your parents, for example, watching your siblings, watching friends at school. All of those experiences start to formulate in a person's mind about how people are supposed to act and how others are supposed to treat me as a person. That's based on my experiences that I have. How you should be in the world, the way I should conduct myself, the way I should speak to others, the way that I should connect with other people around me to form friendships or bonds. A lot of that is molded in the first 6 to 8 years of life. And those sort of like mechanisms are in a person's brain around how this is supposed to work. That's one of the questions that's answered. What the world should give to you. This is also something that happens early on in a child's life. Based on, again, what you're seeing from the people around you. So if I see my parents, for example, really expect people and experiences around them to provide them with things. If one of their thoughts is, the world is supposed to treat me with kindness at all times, and I refuse to accept any time that the people or experiences around me are not being kind to me, you have a high likelihood of sort of adopting that yourself and expecting the same thing from the people and things around you. So that's one of those things where you start to absorb how other people, especially your parents, interact with the world, and you start to adopt that yourself, according to this therapy. And then also how a romantic partner should treat you. That's one of those big questions as well. So what do I expect from a person I'm connected to that I'm going to be in a romantic relationship with? You get lots of ideas of what that looks like, especially from your parents growing up. So you take sort of those ideas that you see and adopt them for yourself moving forward, for better or worse. But that's something that a lot of individuals start to use as they move through life, and they base it on the experiences they had when they were younger, once again. So those are just a few of the important questions that are answered as individuals grow up and absorb the experiences that they're seeing around them. Now, for us as counselors, what are the sort of tools of the trade that we're going to use, that we're going to implement as we're working with clients? There's a few key ones. This is by far not an exhaustive list at all. Adlerian therapy is very deep and complex, and there are lots of different sort of techniques to use, but I'm looking at just a few of the key ones right here. So again, the first 6 to 8 years of a person's life are very, very important. That's something that we want to key into as Adlerian therapist and understand as much as possible. So you'll see counselors using Adlerian therapy really want to talk to their clients around, what did you see when you were younger? What did you experience when you were younger? What kind of things did you that stand out in your mind as important things that happened when you were at a very, very young age? It's called looking at early childhood recollections, and it's something that happens fairly consistently with Adlerian therapy, but we're going to talk about that more as we think about the assignments that are coming up in the following weeks. One of the big things we want to do as well is draw connections from the past to the present. That's the big thing that Adlerian therapists want to do. So what were your experiences? What did you learn from your experiences? What did that tell you about how things are supposed to work? And how are you using those sorts of like rules that you've developed now? That's something that is very important for this style of therapy, to make that connection between past experience and how you're currently functioning. And then also really making sure to highlight the rules that a client is using. And one of the big things to do is when you understand the rules of how a client operates, many times connected to past experiences, are those rules though, are they working for you now? Are they not working? Are they helping you achieve the goals that are really important to you? Or do we need to revisit those rules and maybe change them slightly so that you can be as successful as you want to be? That's one of the key points of Adlerian counseling as well. We want to really sort of think about how you're operating and to really start asking some questions around, does this work for me, or do I want something different out of life? So again, this is a very brief synopsis of what Adlerian therapy sort of looks like, but these are some key points to keep in mind, especially as you think about what's the overall purpose of this type of counseling. All right, so looking ahead, this week you've got an outline assignment for Adlerian therapy, some readings from your textbook, a few pages to read. This should look very, very familiar. You all already did an outline for rational emotive behavior therapy. You're going to do the exact same outline, just filling in with different information from Adlerian counseling. So hopefully that's not that much of a shock to you. But if you have any questions, please let me know. Then during next week, what you're going to do is you're going to actually practice doing early childhood recollection counseling with somebody that is willing to do this with you. So there's in-depth instructions in the assignment, but just as sort of a rundown, you're going to watch a video of a counseling session with a counseling professor and a counseling student. And the counseling student is going to recall some early childhood recollections that stood out to them. And you're going to see the professor make a connection between those early childhood recollections and how the client or how the student is sort of engaging in life at current. So you're going to sort of see that process firsthand with an example from the video for next week. Now, what I want you to do is something very similar with someone else in your life, a friend, a family member, whoever might be willing to sort of step in and be a sort of mock client for you for this assignment. And I want you to do something very similar to what you see the professor do in this video. I want you to ask your mock client about one or two, maybe a few different early childhood recollections that they have. So recollections that as far back as you can think, as young as you can get to, what's the first thing that you remember from when you were very, very, very young? Tell me about that story. What do you recall? What are the important pieces of that? And then ultimately, what did you learn about life or people or yourself from that early childhood recollection, from that early childhood experience? I want you to walk through this process with your mock client so that you can really get a feel of what does this look like from the counselor's perspective. And then, of course, I want you to give a bit of a reflection about what did that process mean to you? What was it like from your standpoint? So I really just want you to get some practice here. I'm not looking for it to be perfect. I'm not looking for you to be a master Adlerian by any means. This is really just a practice exercise so that you can really get an idea of what does this look like. But of course, for your assignments, if anything is confusing or you're not quite sure what I'm asking for, email me, ask me. I'm happy to get back to you as quick as I can. But that's just a quick rundown of Adlerian therapy, another type of counseling that we're going to be looking at this year. So best of luck moving forward with the assignments. And I am really excited to read about your experiences using early childhood recollections next week. Take care, everybody.